Dr. Prodromou, thank you so much for your time. The first question that I have is, what is it like to be treating patients on the front lines in the epicenter?
Well, there's a lot of mixed emotions. We do feel like everybody else, fear for ourselves, for our health. We worry about our families, keeping them safe during this time. We don't want to bring anything home. A lot of doctors that I know have either started living on their own, sending their kids away or their spouses away to keep them safe. So we're dealing with something that's never been dealt on this scale before, and our support system isn't what it is usually. So a lot of stress, both at the workplace and both emotionally and mentally and physically. We have had some losses. Everybody, I think at this point in New York, has 1 or 2 degrees of separation of someone that they know that has passed away from this. So it's just a lot, because you can't really process all of it, I think, because there's just so much. But at the end of the day, you got to keep going and do as best as you can for the people that are right in front of you.
You mentioned many doctors, including yourself, are staying away from family and friends to keep them safe. What kind of toll is this taking on you, and what has the camaraderie been like with the medical staff?
I think all of us have multiple kind of areas in life that can either bring us comfort or stress us at different times. We have our personal lives, we have our professional lives, and if one part of our life is a little bit stressful, we usually have that other end to kind of support us. Sometimes that might, swing back and forth depending on the circumstances. But for us now, we have a very stressful time at work because we are exposed to all these patients. We want to make them better. We're worried about our own personal safety. We're worried about our loved ones as well. But we also might not have the same support system at home because, we're removed from people that we're used to coming home to and, comforting us, our spouses, our kids, whomever that may be. So it's almost that on both areas, there's stress. So it's a tough thing to navigate, but in my experience, I've during my relocation have met such nice people. Everybody is very supportive of each other. There's so much camaraderie, and we're all united under the same goal, and that's to continue the fight against COVID-19. And there are a lot of patients that are suffering now in the hospitals. I have seen the human condition at its worst, but I've also seen humanity at its finest with all the healthcare workers, not just the doctors, but the nurses, the respiratory therapists, the transport, the pharmacists. All of them have really been stepping up, and I'm proud of that. I'm proud to be a healthcare worker amongst that group in this fight.
What are some of the biggest challenges that you're facing?
I think that this is a work in progress. Our goal right now is to flatten the curve. And when we say that, what we're really meaning is that we want to decrease the rate and intensity by which this virus spreads. So going back to that forest fire, we want that forest fire to be as contained as possible. And the reason we want that is because our hospital capacity throughout our nation is limited. We can ramp up to a certain extent, but we don't have infinite resources, unfortunately. When you look at the death rate from day to day of coronavirus, it's in the high 2%, 2.8, 2.9%. That is assuming that we have the ability to treat the patients with the resources that they need, with the staffing that they need, with the ventilators that they need. If we oversaturate our system and we can't keep up with the patient load that's coming because of this disease, and at some point we might get to a point where someone may come with the coronavirus infection and we wouldn't be able to adequately treat them the way that we would want to. And I think that's our greatest fear, is that we don't want to lose a patient because we didn't have the supplies.
Any other thoughts you would like to share about our current condition in this pandemic? Any message for our community?
It's all about fighting for freedom, and that's what we're doing, again, just in a different way. And everybody's in it together. Everybody needs to do their part. The social distancing, you know, kind of having to deal with the sacrifices of, you know, having to shut down a small business for a little bit. These are all really meaningful and very apparent sacrifices that people do, and we can't discount that. But at the end of the day, it's all for a common good, to keep us all safe, to keep us all healthy, and to have us have the ability to get back to our own lives how it used to be, hopefully sometime in the future.
Thank you again, Dr. Prodromou, and all of the medical staff across the world who are fighting COVID-19 and trying to keep everyone alive and as safe as possible. But at home, we need to do our part. So follow the CDC guidelines. Let's follow what Dr. Prodromou is mentioning, because the situation is real. It's something that we're all faced with, and we can all get through this together.